I think it's time to start. I'd like to welcome everyone to this special event today. I'm Naomi, the National Director of Australia for Unhcr. And thank you for joining me and many other people across Australia and indeed the world, and also from some far-flung refugee camps for this briefing on the impact of COVID-19 on refugees and other displaced people. And of course, we really want to hear about UNHCR's approach and response to that. I should say, I hope you are all safe and well. I know we have supporters from every corner of Australia participating today, and I would like to start by acknowledging the traditional owners of the land around Australia. I pay my respect to their elders, past, present, and emerging. We have a wonderful panel of speakers today from across the globe, and really a big thanks to them. From Geneva, Dr. Anne Burton, Chief of Public Health, Division of Resilience and Solutions, UNHCR. From Canberra, exotic Canberra there, Louise Aubin, UNHCR Regional Representative for Australia, New Zealand and the Pacific Islands. From Tyre in South Lebanon, Cameron Rashleigh, Head of the UNHCR Field Office there. And from Kinshasa in the Democratic Republic of Congo, Fabien Faivre, the Associate External Relations Officer with UNHCR. I am fortunate to know well all our panelists, so I can assure everybody who's joined us today that it's really going to be an excellent discussion. To each of our panelists, you all have huge responsibilities right now and a tremendous workload. So thank you so much for taking this time out today to be with us. And to all our supporters who registered and joined us, we couldn't do the work that we do supporting UNHCR without you. And that is what our Frontline Club is about, which this event today is part of, giving our supporters a chance to hear firsthand from humanitarians, from journalists, refugees and others about what's actually happening on the ground. A little bit of housekeeping before we launch into the discussion. We want to be as interactive as our technology will allow, as we know, like working with children and animals, and I'm sure many of us are working from home, so this has probably never been truer than before. Things can go wrong, and certainly it does with technology, but we've got all our fingers and toes crossed that it will be smooth running today. If you have any questions, please type them up in the chat function, and you should be able to see that on the bottom of your screen if you look there. And we'll try and get as many questions answered as we can. So into our discussion, as we talk about quite a lot, you know, there are more than 70 million refugees, displaced people and asylum seekers around the world today. Many of those live in cramped and crowded conditions. Many have underlying health conditions with limited access to sanitation and medical care. COVID-19, as we know, has no known treatment yet and has brought some of the best health system in the world to their knees. So far, there are no known COVID-19 outbreaks in refugee camps or settlements, though we might get an update today on that. But most consider it's only a matter of time. I'd like to start off with a question to you, Anne, with your, I guess, tower view of UNHCR and its health response. First off, can you describe to us from your perspective what's happening globally with the spread of COVID-19 and how refugees and displaced people are affected?
Thank you, Naomi, and thank you to A4U for giving me the opportunity to brief on UNHCR's COVID-19 response. COVID-19 is present in some 200 countries or territories globally, with more than 2 million people affected now. And it's very, very sobering to watch how this has been unfolding, as you pointed out, in mostly higher income countries that have much stronger health systems and social safety nets. We are already starting to see cases in refugees, no major outbreaks yet, but we are certainly seeing cases, and a number of refugee hosting countries have also been affected. So this situation is only going to get worse. Though this is a public health emergency, the effects that we are seeing are far-reaching. Governments are taking necessary measures to limit the spread of COVID-19, including limiting freedom of movement. Border closures are in place in many countries. And many of these measures are necessary from a public health point of view, have heightened the risks for the populations with whom UNHCR is working, impacting access to safety, access to services, and for those seeking asylum. For example, in Syria, 450 community centres, which also serve as child-friendly spaces and women-safe spaces, providing important outreach, psychosocial support, gender-based violence services, and community health, have been closed due to the restrictions there. So in what was already a very, very difficult environment has become so much more challenging. The impact of these government measures globally is affecting all segments of society, but particularly the poorest and the most vulnerable, including refugees. Many have lost jobs, livelihoods. We're also seeing an increase in intimate partner violence, in psychosocial distress associated with confinement, isolation, or loss of income. And we're receiving reports of more and more families sinking further into debt. For example, in Liberia, the main weekly market for refugees, both for sale and for purchases, has been closed, depriving both refugees and host communities of their main source of income as well as their food supply. Lastly, we are also seeing in our operations reporting a rise in xenophobia and resentment towards refugees and displaced populations. As we often see during crisis situations, it's often foreigners who are blamed, who are scapegoated. This is also fueled by poor quality journalism and misinformation. So while COVID is primarily a public health crisis, the secondary effects, including the socio-economic consequences, will have a deep and a long-lasting impact.
Thanks for that. And I just think, you know, we're sort of often hearing, you know, COVID-19 doesn't discriminate, but as you've clearly said, it does in its impact, particularly around those socio-economic aspects. And I know we're going to hear a little bit from Fabien, but also from Cameron in South Lebanon, what's happening in that respect right now, because he's seeing that certainly unfold. From, again, UNHCR's perspective, what would you describe as the biggest challenges when it comes to the response in coordinating, you know, such a huge global operation?
Yeah, thanks, Naomi. I'll just touch on a few points. So firstly, I think the fact that many refugees are hosted in low to middle income countries where the capacity of the health system to manage an outbreak of this magnitude is very variable. We do expect the health systems in these countries are not geared towards the high level of care that's needed. Quite rightly so, because from a public health perspective, they're normally managing malaria and other problems which can be managed at the primary health care level. So we do expect a larger proportion of people dying due to the lack of higher levels of care, especially outside larger cities. And you cannot quickly build these systems. These take years. It's not just a matter of equipment. Another challenge that we have, like for most countries, is procuring personal protective equipment, medicines, and medical supplies used for the clinical management of COVID cases. Firstly, there's a global shortage, as every country and organisation are trying to buy these items. Secondly, many countries that manufacture these are not allowing export of these items, as quite rightly they wish to keep the stock in the country for their own populations. And then third, once we do manage to procure, getting the items to the field is a major challenge due to the reductions in flights and also due to border closures. For example, Ethiopia, the border between both Ethiopia and Kenya and Ethiopia and Somalia is closed. And as local suppliers normally import items from both Kenya and Somalia, this has also caused a serious interruption in the availability of supplies. The third area is humanitarian access. So with travel restrictions, we're very concerned that we may not be able to provide the surge support that's needed if there is a major outbreak in a refugee situation. Many of the surge support that we would use, for example, the emergency setting up of field hospitals would come from Europe or countries that are currently impacted by COVID, and they're not letting health workers leave. And even if they could leave, we're not able to get them into countries at the moment. Lastly, the biggest challenge is, one of the biggest challenges is that the restrictions that have been brought in by governments are disproportionately affecting the poorest, and this includes refugees and other displaced who have the least secure livelihood options, who are dependent on daily labour or small-scale business options, such as the market stalls that we saw in Liberia. So we are seeing the major socio-economic impacts of this, and trying to see that this is addressed.
Thanks, Anne. And you mentioned Ethiopia. I was there with an Australia for Unhcr mission only 3 weeks ago, and we were up in the north on the Eritrean border just as WHO declared a pandemic. And by the time we got to Addis Ababa, you know, I remember coming into the airport, and one of the colleagues said, you know, the world is, you know, on the move, you know, time to get home. And there was that sort of real sense. But being up in Ethiopia, you know, and I was fortunate because I could get home, and I did so very quickly. But of course, my UNHCR colleagues are still there, and I'm still in contact. And we have 2 colleagues here today, Cameron and Fabien. Most of UNHCR staff, as I understand, you know, are in the field, remaining at their posts. How does UNHCR manage that and their health and their needs?
Certainly there's been a lot of concerns amongst staff. We are making sure that the appropriate measures when we're providing assistance to refugees are available for staff. We have been, you know, carefully coordinating at the UN coordination level on measures, making sure that staff, when they're continuing to provide assistance and services to refugees, are themselves able to protect themselves, not only for themselves, but also for the refugees that they're serving. I think one of the biggest challenges that staff is facing, and I don't deal with staff health, so I'm not the best placed person to deal with this, but one of the biggest challenges is actually Medivac, and because many countries have closed their borders, and if we have an ill staff member, being able to get care within that country, or if they need to be evacuated, getting them out. But in terms of communicating, in terms of the psychosocial support for staff, UNHCR has been having regular broadcasts. There is a network of staff counsellors available for staff to tap into. There's also peer support. There's a very large network of peer support in the field. So it is about, UNHCR is where our motto at the moment is stay and deliver, but we obviously need to make sure that the staff are well supported to be able to do that under some very, very challenging circumstances.
Yes, thanks. And just before I move on, Anne, if you could sort of name, I don't want to say the 3 top priorities, so I won't put a number on it, but right now in terms of UNHCR's response, what are the key things out of everything that you've described you're looking at?
So the key things that I would say are UNHCR is we are trying to support national systems to be able to respond to COVID-19 in both refugees and host communities. And often refugees are hosted in isolated, more remote parts of the country. And this is where I see that UNHCR has a definite comparative advantage, because we're very much field based, and often decisions that are taken at capital level or activities may be slow to trickle down, but UNHCR is there and can support the national services to benefit both refugees and host. The second priority, I would say, is supporting the economic consequences of this on refugees. The impact, so support to refugee basic needs, and a lot of this now is being done through cash-based support. So one of the major areas UNHCR has been scaling up its support through cash-based assistance, giving refugees 2 to 3 months, the most vulnerable refugees 2 to 3 months cash in advance, both to deal with the lockdown so that they don't need to leave their homes, they don't need to put themselves at risk, but also to mitigate the impact of livelihood loss. The third priority, I would say, and certainly Louise and other colleagues can speak more to this, is monitoring the protection impacts associated with this. We're very concerned with border closures, with other measures that these might be indiscriminately applied and disproportionately applied to populations of concern to UNHCR. So this we are carefully monitoring, and also taking measures to ensure that there are no long-term implications on asylum space for refugees.
Thank you. And look, while we're on that, I might just flip to you, Louise, before I come to Fabien, because just as, I guess it's a good segue, it seems to, in some ways, I don't want to say a sort of possible contradiction or dilemma, if you will, between the needs to keep the asylum space open. At the same time, countries are closing their borders to protect their populations and economy. I think as the High Commissioner warned last week, the core, what did he say, the core principles of refugee protection are being put to the test. Louise, could you just talk about what the High Commissioner meant by that at that time, and how do countries reconcile their obligations about providing safe asylum and other forms of protection in this wider context of coronavirus?
Thanks, Naomi. I was quite interested in listening to Anne's overview, because in as much as you were asking her to describe, the impact of this pandemic on refugees and what it meant for their core survival or health, etc. I was quite struck with, if you just took out the word refugee, everything she was describing is what we've been hearing here in Australia and abroad, how this pandemic has been necessarily limiting our freedom of movement, how this pandemic is making us very uncertain about the future, how it's a threat to our livelihoods. We're even concerned about should we become sick, have access to proper health services, and that are we getting the right information in a timely way, etc. And everything she was describing, we relate to. And I think the point there is, and even more so why refugees, like migrants and like many poor populations, often have to live in very overcrowded space, making social distancing, you know, that very basic protective measure that all governments have called for to be able to, you know, keep the pandemic at bay, or at least buying time until such time as a vaccine or some kind of cure is found, can be exercised. And refugees in many instances can't even do that very basic thing. So a lot of people here in Australia have really related to this. One of the things you mentioned also in the opening, Naomi, is that one of the very basic things for a refugee, and that goes to the very reality of being a refugee, is that freedom of movement. And why? Not just because it's about freedom. It's actually a right that needs to be exercised when you're fleeing war, when you're trying to anticipate the impacts of persecution, when you're trying to bring your family with you to a safer place. And suddenly that movement and those borders become walls that you can't even cross. And this is the situation that many people now are being faced with. That very first step to find protection is being blocked, that single pathway to protection. So what we are seeing is a mixed picture, though. It's not all doom and gloom when it comes to, you know, I was looking at our region in particular. If you look at across Asia and the Pacific region, almost all countries have some form of restricted movement to enter the territory, or even sometimes to exit. While that is true, many countries have set in place exceptions for people seeking asylum. In other words, have a desperate need to find protection because their home country is unable to protect them. So some of them have exceptions to the entry pathway, and some of them have set in train, of course, those health measures to be able to identify who might carry some of the symptoms of COVID-19 and can be quarantined, etc., like anyone else who'd be entering the territory. So the point is here, one, while there are no formal or cases having been identified in the region among refugees, so to dispel any notion that refugees are first carriers of a virus, it's not true. It might not hold true very soon, not because they're refugees, but because they're human beings. And secondly, there are ways for countries to be able to continue managing their borders in a safe way that's also respectful of the very fact that some people are still, while there's a pandemic going on, some people still are fleeing persecution, war, and human rights violations. So there's a way of combining those things. It's not easy, and there's no silver bullet to any of this, but some governments have really taken on board the fact that they have more than one responsibility. They have multiple responsibilities, and one of them is ensuring also that we continue protecting refugees the way they can. Some countries have put a pause on services like the processing of refugee claims. So while you might have access to the territory, they're saying, you know, it's all hands on deck. All of our civil servants, etc., need to be concerned with and responding to COVID-19, and that's fair enough. Some countries, and we'd like to see more countries though, if they're going to be putting a pause on refugee status determination procedures, is that they put in place a temporary visa arrangement. So for the time being, we consider you as part of us. You're going to be included in health services as we all ensure this for the rest of the population on our territory. And we'll get to your refugee claim after that when we have time. And those are extremely positive steps that some countries have made. Of course, it also means that across the world, you know, we've put a pause on a few other fundamental things. One of them is resettling refugees. And the reason why UNHCR, together with resettlement countries, resettlement is taking a refugee from a first country of asylum where their protection or needs might not be fully met, and resettling them to a third country where they can actually, resume a normal life and bring their families and actually settle there permanently. We've put a pause on this because we're very concerned that some refugees might be caught up in transit and actually be put in harm's way because of this resettlement. But emergency cases still need to move. And another aspect of this is most repatriation movements, so refugees wanting to go back home are also unable to go back home. So there are very fundamental things happening that actually, while as Australians or others around the world, we can empathize with the plight of refugees and say, yeah, it's like us. There are dimensions of the refugee reality that actually mean that this pandemic is disproportionately affecting them, to use some of Anne's terms in describing this.
Yes, thank you. Thank you. Thanks, Louise. Fabien, I'm going to come to you because I'm interested in the impact of the situation in Democratic Republic of Congo, which is, of course, a country that Australian supporters through Australia for UNHCR have supported a number of humanitarian programs over the years. People talk about this COVID-19 epidemic in a humanitarian context being an emergency on an emergency. And I think in DRC, where it's been a long-running humanitarian situation there, that probably certainly is the case. Could you just give us a top-line view of the situation generally for refugees and displaced people in DRC? Which I imagine, everyday life is quite difficult for many people in any case.
Sure, Naomi. Thanks for having me. DRC is a very vast country. It's 4 times the size of France. It's quite, we have more than 500,000 refugees who are mainly coming from South Sudan, Rwanda, Burundi, and the Central African Republic. At the same time, there are also more than 5 million internally displaced people in the country, which is the largest displacement population in Africa. So we're basically dealing with 2 main populations. Adding to that, there is, of course, insecurity and a conflict with armed groups in the mostly in the east of the country. There's a lack also of infrastructure, of roads. Like the people are not really able to access a healthcare system when they exist. So it's quite a challenging environment. We're dealing with several humanitarian crises, and now we're having COVID happening. So it's of course quite challenging for all the humanitarian actors who are working in the country.
And of course, Fabien, in DRC and other surrounding countries, there's been the long-running challenge around Ebola. But as you were discussing with us earlier, DRC is a big country, and east and west, it is still sort of a situation in the east, but in the west, that's perhaps not the main concern. But, I think it's important to kind of talk about, I guess, UNHCR's and general management of communicable diseases. I think for us, it's huge in scale, but to some extent, UNHCR, as I understand, is used to dealing with many of these kind of challenges. How so in the DRC?
True, it's true that Ebola helped with, strengthening awareness on, hand washing and sanitation measures. It's true that in the East, especially in the East, at the beginning, we're already well equipped. If I take examples of our of Burundian refugee camps, there have been already hand washing stations in place. There have been already some refugee volunteers who are raising awareness within their community and spreading, key messages on COVID-19 prevention measures. So we adapted all of those kind of activities in other places across the country. So I don't know if you want to know, it's also what we're doing specifically in the DRC. Yeah. So in the DRC, so we're of course coordinating all our activities with the government. We're working also with UN agencies as well as with partners on the ground. We're trying to strengthen the national healthcare system. For example, in the Kasai province, which is more or less in the center of the country, we're setting up isolation centers where COVID-19 patients could be referred to. In order not to burden general hospitals. As I mentioned, we're also raising awareness. So we're training community volunteers who are then spreading the word to their community. We're broadcasting radio messages in various languages. Distributing leaflets and posters, soap, installing hand washing systems in key locations. So those are the kind of activities that we're doing to prevent while trying to maintain our essential activities on the ground.
Yes, thanks, Fabien. And maybe if we just take this opportunity, we had a small Australia for Unhcr mission to the DRC with our partner Teacher Health to look at some health-supported maternal health projects we were funding. Take this opportunity to get an update on how they are going.
Sure. So yeah, thanks to your support, we're able to strengthen our programs targeting pregnant women and children under 5. So with your support, we're able to equip different health centers. So in northwest of the country, where we have Central African refugees. So we were able also to, in those kind of areas, solar panels, electricity, is a luxury. So we're able to install solar panels, provide drugs and medicines, raise awareness on neonatal care, train healthcare practitioners, and outside of camps where we also have refugees which are living within the community. We often found out that in villages, the ratio was more or less 50-50. There was sometimes even more refugees than Congolese citizens. And of course, the small health outpost was, quickly, it was quickly an issue, to provide services. So with your support, we're able also to provide basic equipment and drugs to support pregnant women, children, both refugees and Congolese.
Yeah, thank you. And I should take this opportunity. I recall it was Anne here today who helped initiate that project. She had just come back from the Badalati region up in northwest there and showed me a photo. I remember when I met you, Anne, in Geneva on your mobile phone, of a birth attendant room, which the delivery table bed was actually a broken office chair with a piece of cardboard stretched across it. And that was the government health post. And at that time, Anne was saying, do you think Australian donors could do something to help this? So I'm very glad we were able to do that. Thanks, Fabien. I'm turning now to Cameron.
Thank you.
Thank you. And we'll come back later because I've got sort of some lovely questions from our participants also. But Cameron, it's quite a different, complex situation in South Lebanon where you're working. Can you describe that for us, please?
Yeah, thanks very much, Naomi, and hi all. Lebanon operation for Unhcr, it's one of the largest operations we have globally. We have a protracted refugee situation here. We have 910,000 registered refugees, but an estimated number of 1.5 million Syrian refugees that have resided here for the duration of the conflict. In South Lebanon itself, we host about 12% of the refugee population, so it's around 100,000 registered Syrian refugees. And we have a variety of programs for them. The Syrian refugees that entered the country, they've always been a number of Syrian refugees that have been here, Syrian nationals that are working in agriculture and construction. And when their families came over during the conflict, they were absorbed into the existing residential community. So we have a very large urban or peri-urban population in South Lebanon. And actually 94% of the refugees in South Lebanon live in such settings. And it's very overcrowded settings that we're talking about, because they're residing in unfinished buildings, agricultural sheds, garages that have been converted into some kind of accommodation for them, where they've been residing for numbers of years, where they can work in construction and agriculture to earn basic living. Of course, this is on top of a significant Palestinian refugee population that's been in the country as well. So it's created a significant impact on the infrastructure in Lebanon, the shelter and the wash needs on the host community. And there's severe economic vulnerability in this country and amongst the refugee population. As a result, 55% of the population is living below the extreme poverty line, and they're living on USD $3 per day. So it's a very severe situation here. 73% of the population is below the poverty line. So the economic vulnerabilities are significant, and we have a very established cash program here to provide support to the refugees that are residing here for such a long time. In terms of the interventions, it's, as I said, it's a broad range of interventions for protection, registration. We provide rehabilitations to shelters to improve the conditions, sanitation improvements. The public health system here is heavily privatized and very expensive. And so we provide subsidized primary healthcare, secondary healthcare to refugees to support them through their basic needs, as well as a variety of advocacy for securing basic human rights. The interesting thing here, over the last couple of years, refugees have started to return back to Syria, and we've seen an increase, particularly in 2018, 2019. That is essentially been placed on hold, as Louise had mentioned, that these solutions are no longer available for refugees, which of course creates additional burdens and challenges for the refugee and the host communities. The cash program that is provided is quite comprehensive. We provide cash assistance to 33,000 households across the country that are focused, those that are very, very vulnerable, severely vulnerable. The amount of money per month that they receive is $175. So it is a substantial contribution, but it doesn't help with all of their needs. That they spend this money on food and rent and medical care. But the challenges are that the lack of residency that refugees have, the lack of livelihood opportunities before COVID-19 meant that refugees had to adopt negative coping strategies to deal with day-to-day life, such as begging, children engaging in labor, child marriage, survival sex, these types of substantial protection issues that exist.
And Cameron, you, like everybody on this panel, has had a lot of experience across various refugee situations. Unlike, I think, many of the situations in DRC where Fabien is at the moment, where you are, it's an urban refugee setting. How different is it in delivering support in that context?
Well, it's quite challenging, and for South Lebanon, it's a little bit different for the rest of the country. There are large informal settlements throughout the Bekaa Valley and also in North Lebanon, and so each of the regions are quite different. We have a scattered population. It's very difficult to identify them, particularly when they're living in these large collective shelters. And we're talking about shelters that accommodate up to 1,000 people in 3-story buildings, converted, unfinished universities. And so trying to work out and provide services to these populations where everybody is highly vulnerable, but there just isn't enough funding to provide support across the board. So we're really touching only and providing support to the bare minimum that are the most severely vulnerable. So it means we are actively working with our partners, trying to map out the needs. In terms of the cash-based interventions, we have a very complex formula that helps us to model the needs and try and predict the needs for the refugees to ensure it is going to those that need it most. But of course, everybody needs cash assistance and protection support at this point in time.
Thank you. I've just got some questions here, and just coming back to you, Anne, if I might, just talking about, and you might have mentioned it, but the scope of need for UNHCR in terms of its appeal at the moment globally, and what partners is it working with in this response? And that's from Jean, and thank you, Jean, for that question.
Yes, thanks, Naomi. UNHCR's current appeal is for $255 million for the COVID response, and unfortunately, we have had a very good response, mainly from government donors. We are still waiting for the private sector to step up. The High Commissioner has been having meetings with major donors, and there is a crisis management team at global level, which the High Commissioner, that is coordinated by WHO, and on which the High Commissioner sits. In terms of, we are also reaching out to major donors on the technical level as well, when there's a need for a more focused briefing on the response. We are working extremely closely with WHO, working together to share experiences from the field, very quickly drafting technical guidance. One of the first guidances that came out was done jointly with WHO, with IOM, and with the International Federation of the Red Cross, as well as UNHCR, on the particular challenges in addressing COVID in camp and camp-like situations. We are also in touch with the Gates Foundation. Gates has been a supporter of UNHCR. We, particularly in health, water and sanitation. At the moment, we are particularly working closely with them in West Africa, in Cameroon, Niger and Chad, and also in Bangladesh. So this is some of the reach out that we have been undertaking. Thank you.
Thanks, Anne. I've got a question from Niall, who's actually a refugee youth leader living in Kakuma refugee camp, who I met in February, and has learnt about our briefing today. His question goes to the engagement and inclusion of refugee voices in the preparation and response. So he's got a number of questions, but maybe if to you, Fabien and Cameron on the ground, you've partly touched on it. But his question is, what type of community engagement mechanism is in place to have insights into the need of the refugee community and adapt messages to the evolving situation? Who would like to respond to that first? Cameron?
Sure, Naomi. Yes, thanks. In Lebanon, we have a very extensive communication with communities program. We have community outreach volunteers that work with UNHCR and work with the communities. They live within the refugee communities themselves, and are able to identify issues and bring to UNHCR's attention those issues. And also, it's a two-way communication, and that was actually born out of Lebanon, and it's now been exported to other operations. And of course, that has rolled into the COVID-19 response. We are establishing community groups within all of the overcrowded settings. This is our priority now in terms of the risks of transmissions and high numbers of transmissions, as well as looking at refugees that have medical backgrounds within the population, to allow them to support within those settings in terms of the identification of suspected or confirmed cases, and also providing any caregiving support during the isolation or the quarantine, which is the same approach, of course, we're adopting here in Lebanon. And we find that the community-based management of these types of situation is the most effective and the most sustainable. So we're very happy that this is the way that we're heading in Lebanon.
Thank you. He also has another question about the COVID-19 task force and how refugees' voices are elevated or engaged in that, which is his more general question. And I think, Cameron, from what you've said, and Fabien and others, there seems to be, the strong engagement at field level and community level, and that's what I have certainly seen on the ground. But how does UNHCR hear those voices at an elevated level? Who would like to take that? I'm looking at you. Louise, thank you.
Hi. Well, sometimes we make it sound exceptional, but the best, most effective responses have always ensured to have refugees very central to the preparedness measures and the responses. And so you'll have, for example, I take Bangladesh when not only because I was there, because it's an approach of UNHCR. Among the refugee population, the Rohingya refugee population in Bangladesh, we have over 3,000 community volunteers. And they range from people with medical backgrounds, people with community mobilization skills, women's groups, etc., with a multitude of tasks to carry out. One is very central to this pandemic, and it is ensuring to disseminate accurate information on how to protect yourself, how to protect your family, and how to access services. So you have that as a modus operandi, if you will, in Cameron and Fabien have both described different aspects of this. And it's very important to keep touch not only about refugee voices, but also what they can contribute, because over and beyond the mobilization of communities, I mean, you also have among refugees engineers, doctors, you have nurses, you have religious leaders, tons of people who have a very singular role to play, and particularly in this COVID-19 crisis management. I've seen here in Australia, a call for among communities, and it includes, of course, refugees, people with medical backgrounds, to be able to contribute to a national response. And we're seeing this replicated now globally. So in South America, there's been a call for, refugees with medical backgrounds to step forward, to be identified, to be able to be, on call for their services. And it's very important. I think we've always tried to make the case for how and why refugees need to be considered as part of the national fabric, for not just in crisis management, but it just makes good sense. So for example, if it never made good human rights sense to keep refugees or asylum seekers in detention, it certainly doesn't make good public policy sense to keep them in detention, particularly now when you can't exercise social distancing in detention. And what do refugees bring to communities when they are not in detention? Well, they bring their skills and their support. And again, it's not new. We've seen it during the bushfires here in Australia. We saw refugee communities, refugee restaurants, refugee catering services, making sure that people had food and making themselves available, packaging, etc. And we're seeing this again. Refugees are translating information for their communities, making sure to disseminate information, and also among them, as I say, some people with very specific skills. I think, when we look across the gamut of efforts at this point, and forgive me for, even repeating a phrase that even our Prime Minister here in Australia said, we're all in this together, is because we all in this can actually be contributing to keep each other safe in whatever way we can. And that must and really does include refugees.
Thank you. And just coming back to you, a couple of questions focusing around food security generally in places like Yemen, you know, which has received, you know, quite drastic media at the moment, given the situation there. What are the challenges for UNHCR? How do we manage it in places like Yemen, not only in terms of food, but also with the other logistics of supplies to some of these countries?
Yes, thanks, Naomi. Yemen is certainly one of our priority countries, and they do have cases of COVID that has started. We have been in touch with, we have an extremely capable team there, and one of the challenges in Yemen is because of the years of conflict that 50% of the health services are not functioning, let alone functioning at the level that they should be. So this is one of the particular challenges that we are facing there. There's also a lot of movement restrictions that have been imposed. It's very difficult to move from, you know, even from one governorate to another in the country. Our office there, in terms of food security, our office there has already taken measures to give refugees advanced cash. They've expanded the number of cash distribution points, also looking at trying to put in place measures that are going to reduce the risk for refugees and other populations of concern. Of course, our major response in Yemen is with internally displaced. So expanding the number of banks that are, or service providers that are able to provide cash, staggering the distributions so that not everyone is coming at the same time, and then having appropriate measures in place to, you know, for hand washing and such like, to reduce the risks for refugees at that time. So they're the major, in a situation like Yemen, even the markets, the local markets in terms of food, as long as they're still functioning, cash is the best way to be able to provide assistance there. But the World Food Programme is also supporting particularly refugees who are in camps with in-kind food distributions as well.
Thank you. Just a few more questions before we finish up. One, and thank you to Andrew and Barbara for those other questions, but Georgia has asked about the situation of women and girl refugees who can be particularly vulnerable in these kind of situations, and if someone could respond how they currently are impacted and obviously supported by UNHCR. I'm looking at Anne. I might, Fabien, ask you, or Anne, are you happy to answer?
I mean, I can certainly.
You made the
start.
mistake of not muting.
Yes, I can certainly start. I think that, you know, it's so. Certainly, I mean, this crisis heightens vulnerabilities with existing vulnerabilities. We don't necessarily, you know, and, you know, we are very much aware of that. And UNHCR has been consulting with women, girls, men and boys throughout the response. But, you know, there's no doubt that with the lockdowns, with the restrictions, women often being, you know, the primary caregivers for children, with children being at home, with the impact on livelihoods, that women will be, you know, will be bearing a lot of the brunt of this. This is also manifesting, as I had pointed out, with an increase in intimate partner violence, exacerbated by the lockdowns, by the confinement, the isolation, and also the loss of livelihoods. UNHCR has been putting in place remote mechanisms to respond, telephone lines, and being able to follow up with being able to follow up on complaints or support for services remotely and as confidentially as possible. The other measures that we have been taking, of course, looking at vulnerability, looking particularly at female-headed households, looking when we're providing cash-based assistance, looking at gender-related vulnerability when identifying the most vulnerable households. I might leave it at that and see whether or not there's other comments.
Thank you. I'm just going to ask Louise, who was the emergency coordinator on the ground during the early days of the Rohingya crisis for quite some time, and this would have been a big issue there. How did you manage that, Louise?
Well, it was a tall order to manage, but
Right.
one thing that needed to be dispelled very quickly were the myths about Rohingya women. For example, when I first arrived, there's a notion that it's a very conservative society, and women were not going to feel comfortable taking on public roles or engaging, more broadly with the community, etc., as would require or seem logical for a UNHCR response with refugees. We do it very much in partnership with refugees. So, but very quickly, when asked, women, do you want to be part of planning teams? Do you want to be distributing food or materials? Do you want to be part of the education committee to try to look at, informal and formal ways of continuing the education of children, etc.? I mean, the response was overwhelmingly very positive, and they are engaged. And today, when I mentioned, the 3,000 community volunteers, there's nearly half of them are women at this stage. So I think there's, there, as Anne rightly points out, compounded vulnerabilities can really be quite exacerbated in a moment like a pandemic, where there's a public health imperative that needs to be addressed, etc. And at the same time, people have skills, and we shouldn't have preconceptions. At the same time, the home is not always the safest place, unfortunately, for too many people. Children and including adults, and among the adults, disproportionately women. So UNHCR's inability to continue working with refugees, so if there are travel restrictions, if there are access restrictions, etc., makes it quite difficult to keep a pulse on what is happening in the communities and try to manage that. The other aspect of it, so I think Cameron is the one who mentioned hotlines and making sure to communicate in different ways, and I think this is where we're really seeing the benefit of technology. Technology or a drone would never replace human-to-human relations and that conversation that seems to be more easily had when people are face-to-face, but it is an enabler in this context, there's no question. So discussing with governments and policies that would restrict communication, ways of communicating for refugees, I think is a very important element of our advocacy going forward, making sure that refugees have access to the information and services, and women here play a very singular role. There's another aspect to this, and it is the equitable access to services and materials. So if distributions are done in a haphazard or chaotic way, you'll often see that women and children are unable physically to access that material. But if things are done, with them in mind, buckets and jerry cans for water and soap and material, etc., can more easily be targeted to women and children who otherwise might go overlooked. So these are very important management elements of large populations, like in Bangladesh, like we saw with the Rohingya.
Thanks. Two final questions. We're all, many of us as parents now, becoming teachers in our own homes, not very successful ones in some cases, but obviously education is really vital. And a question from Ian about the most effective ways for donors to assist refugee students and children during this period. I'm going to call on you. I might call on you, Louise, actually, if you could answer that. And then we've only got a couple of minutes. I've got one more question. So,
well, maybe thanks for the question, because it is so important. We've always said that, you know, education is one of the most, it's not only just a basic right, which in and of itself is important enough for refugee children, it's fundamental to their protection as well. So keeping children not just between four walls with a teacher to avoid them being in harm's way, but also having access to quality education, because that gives them the tool to be able to then resume a normal life, whether it be there where they are in asylum or returning home, or whatever the future path may lead to. I think there are two ways of helping. Anne mentioned, you know, a global appeal that so desperately and very critically needs to be funded in the most urgent way possible. She did make a particular call to the private sector and to individual donors. I think it's very, very critical. But your voices count as well. We've been saying for so long, it makes more sense, more economic sense and more efficiency sense to include refugees in national responses. This time we're talking about a health response, but very soon we're going to be talking about a socioeconomic response, making sure that no one's left behind when we try to get out of this. Mm-hmm. Because for every one refugee or one person, one poor person, etc., left behind, we won't be able to get over this curve and come out the right way with people that resilient, etc. And the third aspect is obviously so the inclusion of refugees in national education systems is so important, that you're lobbying for that, I think, is very, very critical.
Thank you. Last question I'm going to throw to Cameron, and it's about, from a number of people, but about how UNHCR works with its partners in the field, you know, its large partners, UNICEF, you know, World Vision, much smaller sort of local national partners. We always say we never do this alone, it's with many friends. How does it actually work in the field, and how's it working for you at the moment?
Absolutely, Naomi, and thanks for the question. Of course, we do this through coordination. There's a well-established coordination mechanism that exists for any response to refugees or displacement with our UN partner agencies, and also international and national organisations. And of course, particularly the national organisations, national government, non-governmental, they have you know, a particular understanding of the local context, because they're from that context, and they know the situation, the political, the socio-economic environment. So we work very closely. In terms of the COVID-19 response, UNICEF is working hand in hand with UNHCR. They are leading the water sector, and so they are dealing with the water, sanitation and health and hygiene responses within the overcrowded settings with all of the partners that they have through the water sector. UNHCR is leading the shelter sector, which allows us to move progressively around these overcrowded settings to identify potential areas for isolation, to set these places up for refugees who are confirmed or suspected cases. And it's through this regular coordination. At this stage, we're meeting every couple of days with partners to make sure that we are on the same page, and there's no duplication in delivery of hygiene products or awareness sessions on hand hygiene and these types of promotional activities, prevention activities, but also in terms of the response. And of course, the local government authorities, the ministries are on board with this as well. For relevant clearances and coordination and integration with the national response. So yeah, the way we do everything is through partners. We're stepping forward together.
Thank you. And that's a great note to finish on, because we're very proud to be your partner too there, Cameron, as Australia for UNHCR, with all our supporters listening today. I really appreciate, as I said, all of you taking time out today. And thanks for everybody who's been online joining us for our first online Frontline Club. Combating this outbreak in refugee communities requires, as we know, a huge global effort. And I know our teams, and some led by our wonderful speakers today, are really up to the challenge. We've taken on major public health challenges before, and as described by all the speakers today, we're rolling out a major global operation. In times like this, it's so important that we look out for each other, particularly the most vulnerable amongst us, and refugees and displaced people are certainly that globally right now. I ask everyone to please take care, and thank you for standing with us and with refugees at this critical time. Thank you so much. Now we can all wave.